Hello, my name is Stanley Okoro. I'm the founder and technical and product lead of Chisom. Now, Chisom is a care operations and intelligence platform designed for supported living and also residential care, mental health services, early disability services, autism support, and complex care providers. It can also be used to manage domiciliary care. The platform is built around three core innovations. The first innovation is and AI-assisted care note sentiment and risk analysis. The second innovation is support ratio-aware rota and service user allocation. And the third, Ask Chisom, which is a permission-controlled and source-linked care record retrieval system. These innovations are designed to improve care governance by helping managers retrieve evidence more efficiently, identify developing concerns earlier, and demonstrate that access staffing requirements are being translated into actual care delivery. So now the first innovation, which is, okay, let's start with Ask Chisom. So I'm going to log into the system right now. So we have to understand that this system uses two-factor authenticator. So staff, we have to, after going through the email and password, so you have to put in your Google Authenticator code, which is from here, from my end, 696. So when I log into the system, it takes me to the home page because this is an admin account. So from here, you can see you can have visibility into the performance of the service in terms of executive, in terms of care, quality, medication. So everything that is going on in the service, you can always have first-hand analytics. So Chisom is actually like a data analytic platform that's for better governance that help management to be able to know from a glance how the service is performing. So if I should click on care quality, this talk about daily log outcomes and everything, care category distribution, service user. So there's also medication. This has to do with EMA, the electronic mark chart and stuff. And also there's finance, which talks about the finance is actually the service users finance because on Chisom, because I said earlier, it's for supported living. So supported living staff are also responsible for managing the finances of the service users. So from here, you'll be able to see the records. So there's workforce, this is for payroll, pay slips, and everything. And there's also navigation. This is like for domiciliary support, domiciliary staff. And you can also drill down into the different sections. So let me just briefly take you through the different sections. So we have navigation. This is where for for domiciliary workers. So with this, you'll be able to like get the location of the client they are going to visit. These daily logs where you put in different logs concerning the clients. There's required task section. These are tasks that are compulsory for each client or service users. So it's also email. This is where you this like an this is like a map chart that's electronic map chart where you record the medication of the service users and stuff. So finances, this manages the finances of the service users. You can create a bank account, you can create team, you can create as many as you want related to each service user. Like if you notice this transaction is for Yusuf Mohammed. So Yusuf Mohammed is like a service user on the system. Also there's payroll where you can manage staff payroll and it's actually very detailed. You have pay slips, work hours and everything. So this is where service users are created and displayed. So this is also where staff are created. This is where you manage staff, where you can add training, education, driving license, um, conduct and capabilities, and so on. Then this care notes, where care notes are recorded, is sentiment, which is part of the innovation. It's one of the innovation actually. Then this rota system, and now this is assign shift, which is the second innovation. And then the third innovation, which is Ask Chisom. So Ask Chisom is like an AI feature whereby you can have information concerning anything like staff, um, service user, as well as policy. Anything within the system. If you ask something that is not within the system, you won't be able to get such information. So the information is strictly for the things that are within the system. So now for the first innovation, which is Ask Chisom. So we're going to begin from here. Ask Chisom allows authorized users to ask questions about care records in ordinary language, and then they receive answers based on information held within the organization's Chisom environment. Let's take for example, if a manager should ask, which recent notes mentioned increased agitation? Have there been repeated medication refusals this month? When was the service user's risk assessment last updated? The innovation is permission controlled as well. Retrieval is based on the role of the individual. So the information that a manager can get from this is different from the information that a normal support worker will get, because everything is role based. Like I said, a support worker cannot be asking about information regarding payroll of his staff. That is not permitted. So if they should do that, the system will make them understand that they don't have access to such information. Whereas if a manager should ask such information, it will search the records and provide the information. So if you look at this, these are previous queries that I've sent into the system. So summarize today's important care records. So there is no care records available for today. So this was done previously, right? So now I need to add. I can create. I can actually create a new chart. So this is a new chart. So from here, if I should click summarize today's important care records, let's see what it's gonna say. So the system uses AI, so it checks all the records, and then based on the records that is in there, it comes out with information. So these are what it got for Yusuf. Today's important care records for Yusuf Mohammed highlight two critical incidents. First, during personal care involving toothbrushing, Yusuf sustained an injury. Alright, so what is gonna happen? We're gonna do this with another service user. First of all, I need to create another service user. If I should come over here, service users, and then I create, let's say this is Annabelle Hopkins. Annabelle Hopkins. So Annabelle is female, then diagnosis of, let's say, autism, medication, let's see metformin. This is just like a test sample. Let's say by day Annabelle is 2 to 1, and by night Annabelle is 1 to 1. So this actually helps, in the second information, which is rota aware, and services are aware, rota allocation. We'll get there soon. So let me create an account for Annabelle. So this is Annabelle, right? So if I should come over to Ask Chisom, and because I just created this account, if I should ask, tell me about Annabelle, it will tell me based on the information it has concerning Annabelle. Then Annabelle means female, authorized, evidence born on the 18th July. If you notice, we created this today, and by default, since we didn't choose a date of birth, so it took today's date, diagnosis of autism, prescribed metformin. So this is what we just created, if you can remember. So now if we should go to daily notes for Annabelle, let's say for instance we click on this and then we come to, for instance, let's say body map. So let's say Annabelle has a bruise on both hands, right? So I can select left hand and right hand and then come to, let's say pain score is like 5. I can write a title, bruise on both hands. Then I can come over here and say Annabelle fell down during personal care and bruised both hands. So then action taken, I can say team leader was informed, and then I can put an evidence, can actually create an evidence. Let's say there's an evidence, maybe I can snap the bruise and put it there. So you can either use camera, you can also upload from device. So anyone that is okay. So from here, but from now I won't be using this though. So let's say follow up because this because she has a bruise on both hands. So I want to follow up and then raise it as a, I want to flag it as a risk concern. So when I do this, because this is an admin account, admin will receive notification here. So this like let's assume this is a normal staff writing this, right? Yeah, but this is an admin account obviously. An admin account have access to all features, but then normal staff have access to some of these features, but they don't have access to all features. There's row level security. Yeah. So let's use this account for the sake of time. Let's use this to explain everything. So now, since I followed up and I flagged this as a risk concern, when I save it, admin will receive a notification here. So daily log saved and admin roles notified. So we have to wait for some time and then admin will be able to. So the essence of notifying admin is because when something like that happens, admin they are supposed to take action. So as we can see, the notification has come in. So if I should click on this, said Annabelle Hopkins, follow up required, raise concerns. So what is it? It's a daily log for Annabelle Hopkins, right? Yeah, open daily log. So all we have to do now is to go check it. So I can click this and then this is where I go to follow ups. And then when I click on follow ups, I'll be able to see it. Then female front, left hand, right hand, pain score 5. So this is what we imputed if you remember. So as admin, the essence of this is for staff to escalate an issue and for admin to be able to like respond to the escalation. So that is the essence of this. So if I should come over here, for instance, let's say admin, me as admin, I feel I've resolved the issue, right? So I can write something like code 111 and she was treated accordingly. So with this, I'll be able to like as management, I've treated this as resolved and then what happened, then I can record response. So my response shows here. So the essence of this is for audit. So if there's an incident, what happened? Was it flagged? Did the staff flag the incident? And if it was flagged, what did management do concerning it? So that's the essence of that. So now this was flagged by staff and then this is management response. And this, you can actually have different management to respond on it. Like I said, this is row level. There's row level security. So any staff that has the role to be able to respond, they will be able to click on this and respond to it. So that is the essence of it. It's for like audit trail for governance, better governance, what happened, what the staff did, and what was management's response. Good. So that is okay. So now this is for daily logs, right? So let's go to EMA. So this is also EMA. So let's say Annabelle. I can add a medication for Annabelle. Let's say metformin, which is which is in the records. So let's say it's 500 mg tablets dosage. Let's say two a day, oral, regular, once daily. You can say three times daily, 9 o'clock. Then let's say 3 o'clock, and then the last time is like let's say 9 o'clock again in the night. So these are the three times I should be taking. Then what is the number of stock? I can see 150 tablets in stock. Production date, I can put any date. Date received, I can put it as yesterday. Then date opened, I can put it as today. Expiry date, I can put it as 2028 June 21. Then review date, I can put it as maybe next 2 weeks or so. So I can say this medication is for mm, let's say for diabetes, for instance. So whatever is here, so it's just like for the system to understand what is going on. So maximum dose, example, maximum 8 tablets. So you can put anything there, but you can also leave it blank. So if it's a controlled drug, you can indicate here. If it's high medication, you can put it here. So I'll just leave it as only active medication. So this is a medication that has been created for Annabelle. So now because time is 2:05, it's already flagging this as late, which means that it is due, but it hasn't been administered. That's why I say overdue since 9 o'clock. But this one, 15 o'clock, that means 1 hour time. Because it's not due, I won't be able to click on it. So if I should click on this now, I'll be able to, let's say I want to administer this medication. It already knows that it's two dosage. And this stock before, stock after will be 148. So if you look at the stock before is, so everything is well calculated. So it's just like a map chart that tells everything that is happening. So I can put a witness, let's say Sophia, then notes, I said complied with morning medication. Okay, then I can, it's okay, I don't need to follow up, I don't need to flag it. So when I click on save record, you see that it has dropped to 148, and then the record is, if I go to audit tree, I can see it. So there's an audit tree for all the medication because this is metformin. It shows here metformin 2 tablets given stock after 148. So this is a very detailed what is it called? This is a very detailed email chart for service users. So if I should come over to finances, finances is the same as well. So this Annabelle, I can create add accounts. I can put a cash team for Annabelle, and then cash opening balance. Let's say Annabelle's opening balance is 125.35, right? Then safe limit, let's say is 500. Stored in company safe. So now let's say it requires two witness. So I can add account. So this is the account I just added. So with this you can add money into the account and you can remove money. Money in, money out. Money in we increase the figure, money out we increase the figure. So Annabelle took let's say Annabelle took £20 from this for shopping, right? Then description bought food items for the week. Okay, so now if I put the receipt number, let's say this receipt number, then staff name, let's say David, in second, let's say Sophia. So notes, shopping done. So with this, you can put evidence like the receipts. You can attach receipts to the transaction, for future reference and stuff. So the good thing about this, instead of I've worked in so many supported areas, I've never seen something like this. I've had the opportunity to use a lot of softwares, and I've also seen the software that manages the services as finance. That was what prompted me to build this. Yeah, so now if I should click on save transaction, receipt confirmation is required for expense of £20 or more. Okay, so let me reduce it. Let's say this was £5. Yeah, I don't want to impute receipt, but you can put receipt. So now, initially it was 125, now it has dropped to 120, and then management can approve it or reject it and stuff. So there's also discrepancy. It can be you can flag off discrepancy as well. So that is the good thing about it. So all this said is for me to explain how this innovation works. Ask Chisom, right? That was why I had to put in this record. Like I said, Ask Chisom gets information from the system. Okay, Woodland support admin recorded finance transaction for Annabelle. Okay, it's required admin review. Okay, so this is like a notification based on that financial transaction we did. So now I need to explain this as Chisom pressure. So if you have been following me, you see that I have done how many transactions did I do for Annabelle? I did daily logs, I did email, I did finances for Annabelle. So now I can come over to this AI feature and then ask Chisom. So if management wants to know how Annabelle has been today without getting to check all the records, so management can just come here and said, tell me about Annabelle today. So the system checks all the records for Annabelle and is able to pull out all the records for Annabelle, and then admin can just know from a glance what happened without going to read everything about each service user. That is innovative. That is the essence of this innovation. Yeah. So today, Annabelle Hopkins experienced a 4 during personal care, which resulted in bruising on both hands with a pain score of 5/10. If you remember, that was what we did in daily logs, right? The team leader was informed. If you remember, we flagged it off and we actually imputed that team leader was informed. And a follow-up is required due to risk flag. Annabelle complied with her morning medication, received metformin 500 mg tablets as scheduled during the though the medication was administered later than planned at 14:05. If you notice, the medication was due by 9, but we administered it 14:05. So that was why this AI was able to track it that it wasn't administered on time, right? A shopping expense of £5 was recorded for food items for the week, pending financial approval. So it hasn't been approved by management. Annabelle's risk level is medium and she's diagnosed with autism. The incident has been flagged for urgent review by senior staff and management. If you notice, that fall was flagged. So that was why the AI knows that it was flagged. A 111 call was made and Annabelle was treated accordingly. That was the management's response, if you remember. Then further management action and clinical review are recommended to ensure her safety and well-being. So this is just like a suggestion from the AI. So if you look at this is actually innovative because imagine a, a service with like 15 service users and the manager wants to know about each service user. They will need to start checking daily logs, email, finances, payroll, and so many other things for that service user before they'll be able to come up um with what is it called? They'll be able to come up with what happened to that service user. But with this AI system, all they have to do is just tell me about this service user today, just like I wrote here. Tell me about Annabelle today, and it brings out all the information about the service user. So that is actually innovative. So without wasting your time, so let's go to the second innovation, which is sentiment analysis, right? Sentiment analysis, that is the second innovation. So if I should come over here, I can actually copy this. I'll show you how it works. So when I copy this, it's been copied. I go straight to um, care notes. So this care notes, this is where we summarize everything that happened for that day and put it in as a care note. And now this care note is linked to the risk assessment as well. So whatever information you put here, there's an AI feature that knows the how risky such note is, like in terms of the tone of the note, using a natural language processing. For instance, if I should come over here, this keynote, and then if I should impute that keynote I just copied there, right? So I can put. So when I click on save entry, I'm saving this for Yusuf Mohammed, and that is wrong. I should save it for Annabelle. So I should come over here and go to Annabelle Hopkins, and then save it for Annabelle. So now this is for Annabelle. So when I click save entry, so this keynote has been saved in the system. The good thing about this is that you can always retrieve every keynote all the time. And now you retrieving the keynote, you'll be able to know how the different service users have been over the time. So now if you look at this now, there's a notification. When I click on it, it says a high risk keynote has been recorded for Annabelle Hopkins. Summary: high medical emergency key was detected 111. So this shows that the second innovation, that is sentiment analysis, has flagged this note as a high risk note. So when I come over here to sentiment and risk, I'll be able to see it. So now looking at this, everything is empty because this what is selected is Yusuf Mohammed. So if I should go to Annabelle Hopkins, I'll be able to see that Annabelle is challenging. So this innovation uses an algorithm that actually transforms text into graph. Why is this necessary? Because the truth now is, in a care setting, you can have up to thousands of care notes in a month. And you can't be reading all those thousands of care notes, they are just too much. So what do you do instead? You need a system that separates this care note into graphs in terms of positive, neutral, agitated, challenging, and withdrawn. That is it over here. So with that, you'll be able to know that, okay, from looking at this already, I don't need to read the keynote. I know that Annabelle Hopkins was challenging today. And I want to investigate what made Annabelle Hopkins challenging today. Positive is low, neutral is low, agitated is low, challenging is high. So the good thing about this is care records should not be given to AI to process. AI can help in terms of detecting patterns, but then management should also review it and approve it. Management should not depend solely on AI, and that is even part of the terms and conditions of using Chisom to be well stated in the policies and in the documents, the supporting documents before onboarding a client. So now, how does management correct this or alter this? So management can also click on this. If management feels that it's not okay with this cause, but then reading this, the reason why it's challenging is because it found that she broke her leg, her two hands rather, sorry, and then it was escalated. 111 was called. So this is something that needs attention, right? If it was something that doesn't need attention, it would flag it. If I should put a happy note, I'll put a happy note less so you see what I mean. So if management is not comfortable with all this, management can always edit it. Let's say I want to make this instead of 1.7, I want to make it 1 for instance. Then I can come over here, make neutral, let's say 2, and then I can make agitated, let's say 20, let's say 40. Okay, let's reduce it. So the idea is to have um, okay, so I just want this height to be 100. Just want it to be 100%. Okay, so this is okay. So we can leave it like this and then we can save it. Alright, so from here we'll be able to click on save changes. And then if you notice, when we get back here, we see that positive is now 1, neutral is 2, and then so management can actually edit it. The good thing behind that is that you don't just take any figure that the AI gives to you, even if the AI figures are actually reasonable and based on the content of the keynotes for the context of care environment. The AI shouldn't be the one that will make the decisions. Unless the management has reviewed it and is okay with the AI figures, and that is okay, of which most of the time the AI gets it right in terms of the scores assigned to each risk level, like positive, neutral, agitated, challenging, and withdrawn. So that is the good thing about it. So let's go back to care notes and write a care note that is not high risk. So if I should come over here, so this is the first care note, it shows under care note. So if I should click on this and write another care note, let's say for instance, Annabelle was very happy when her mom came visiting. She, she had some ice cream, watched a comedy show, and laughed throughout her mom's visits. So now if you look at these notes, this is actually a positive note, right? Another good thing about this, instead of typing, you can actually use voice input. For instance, if I should click on this and say, Annabelle's mom came in the afternoon. So if you look at this now, this another's mom. So it's based on AI, based on the way it captures your words. You can see whatever I'm saying is here. So unless you click on this, you have to stop listening and stuff. Yeah, so you can just go through it and then correct whatever you want to correct. But then if you are clear enough and your mic is okay to capture the right words from what you're saying. So let's leave it as this though. So Annabelle was very happy when her mom came visiting. She had some ice cream, watched a comedy show, and laughed throughout her mom's visit. So this shouldn't trigger anything because this is actually a good note. This is not a high risk note. It shows that she's happy. Her mom came visiting. She kind of enjoyed herself. So if I should click on save entry, I'm not expecting any notification from this. So notifications only come when the note is high risk. So looking at this note, there shouldn't be any notification because this note is not high risk. But the first note here is high risk. That was why it was flagged and there was notification. But because this is a low risk note, there won't be any notification. So if we go back to sentiment and risk, then click on Annabelle, then you see that it has changed, right? The note has changed. Why? Because now there's now neutral, positive, agitated, challenging, withdrawn, and stuff. Before it was only challenging. Now, if you look at this, the score is 13. This is the new note. Is the risk is low. The first one that we sent was high, 92. Now, the second one is low, 13. So if I should click on this, I'll see the rate this distribution. They see that this note is 38% positive. This note is also 48% neutral, agitation 0, challenging 0, withdrawn 30. That is because there's no level of agitation or challenging behavior in this note. Let's read the note. It says Annabelle was very happy when her mom came visiting. So this is positive. She had some ice cream, watched a comedy show, and laughed throughout her mom visit. So there's no level of agitation or challenge. That's why it's zero. And withdrawn 30%, which is also low. But then if management is not okay with this, maybe we can make this. These are just based on the AI score. So we can come and make positive, let's say 60, right? Then we can make neutral, let's say 30, right? We can make withdrawn 10. So if I should come over here and save. So now the score has reduced to 3. So when we click on it, now positive 60, neutral, withdrawn 10. So the good thing about this, I know some people may be asking, like, is this for only one day? Now, this can actually be used to, see these service users and behavioral position for a period of time, maybe a week time, maybe a week or a month. That's the good thing about it. So imagine a situation whereby there are thousands of nodes, right? And then we can see that there are thousands of nodes, and then we want to really get some insights because the truth is data analysis, clinical governance is very important in any health setting. And then you have to realize that sometimes the data that are available, especially in supported living residential, they are not numerical. Looking at this now, it is as a data analyst, because I'm also a data analyst, it's easier to be able to get this kind of graph from numerical data. What do I mean by numerical data? Numerical data are the kind of data whereby it shows numbers, right? So now, if you click this now, value of positive is 30.5, neutral is 16, agitated 12.54, 33.92, challenging, withdrawn 7.23. So all these figures, 30.5, 16, these are numerical values. That is why this graph has been plotted, because it is easier to plot a graph with numerical values. But then, how did we get these numerical values? They were gotten from keynotes. And where are the keynotes? These are the keynotes. So this is the innovation here. The ability to transform a keynote, which is text format. These are not unstructured data, because this data, they are not structured. It's like a text. So you have to read through to get the information. But now, this technology, this sentiment analysis converts this keynote, which is an unstructured data, into numerical numbers and then interpret it as a graph. So that is actually innovative, such that a manager can say, for instance, they want to know how this service user, this client, Annabelle, has been throughout the month of July. So you can select 1st of July, and then let's say today is the 31st of July. Then it will bring out the behavioral pattern in a graph. So from the graph, you can know that, okay, this month of July, this person was more challenging, more positive, more neutral. That's a very good thing, actually, because you don't need to be reading thousands of keynotes to get this information. And the good thing about it, for instance, if you look at this now, this is minimum risk score. So now, because it's zero, it shows everything, right? So now, if I should come over here and increase this to, let me say I want to get the note that has risk score of at least 90. So I can drag this to 90. So when I scroll down, I see there is only one note. It has removed the other note, which is let me go back again. If you notice, these were two notes, but because this is a positive note, so the risk score is low, which is 3. So I can decide to filter and then get only those that are 90 and above. Then it shows only one note because there's only, obviously there's not much data in the system. So imagine a month period that has, let's say, hundreds of row of data. You'll be able to see hundreds of row of data. So with that, you'll be able to already know the care, you can easily identify the care notes that have high risk. For instance, do you understand? You can easily know the care notes that has high risk. So now, if I should click on this now, I'll be able to see this is one of the care notes. So obviously, over a month period, there will be more than one. So you can just click on each individual note and read it and detect patterns. Another good thing about this Ask Chisom, you can even go to Ask Chisom and then tell Ask Chisom to check this month and know the risk involved in terms of this client's behavioral patterns over the month. So these are things that are very innovative because you just get to understand how this services has been without getting to read too much notes. And the good thing about it, Ask Chisom can also give you suggestions how to modify the care plan because care plans are not static. They are always changing based on the behavioral pattern of the service user. So you can go to Ask Chisom and tell Ask Chisom to help you get as a refine the care note, and it will be able to do it for you based on the patterns it has discovered over the time period that you specify. So that is a good thing about this. And also you can also sort this high to low. You can go from newest to oldest. You can go from oldest to newest. So you can always sort it any way you want. You can remove, withdraw. You can just only positive. Then you'll be able to see the graph is changing accordingly. Positive is very small. Rest are deactivated. You can group trend by day. You can group by week. Can check for last 7 days this week. So it's actually details. If I should click on last 7 days, see what it shows. 12 to 18. This week 13. If I click on months, it goes from this to today, which is 18, because obviously tomorrow there's no activities tomorrow yet. So it's actually very detailed. This is a very detailed system. If I come over here, click on filter and stuff. Yeah, so you can remove filter, you can add filter and stuff. You can also refresh it. Then the good thing, you can also export this as CSV. You'll be able to see the information here. So these are the information in case maybe you want to give it to a data analyst to get more insight from the information. You can easily do that. So that is the second innovation. Then going to the third innovation, that is the rota system. So if I should come over here, click on rota, this is where shifts are assigned, right? And the good thing about this rota system is that it separates shift allocation and like rota allocation and also shift assignment. So how does it work? If I should click on this, let me say I want to assign a day shift to Woodland support admin. So I can choose whether it's day shift, maternity leave, emergency leave, compassionate leave, whatever it is. Let's say day shift, I can click on this. Then I can put a note, for instance, maybe bank staff, let's say traveling with service user. So this, let's say this staff is traveling with service user for a 2 day period, right? Then I can save it. So these are the 2 days. So you can look at the manager's notes, traveling with service user, and also with this. Then if you come over here, see there's no manager's note. So depending on if you put manager's note or not. So that is a good thing about this. Then I can come over to this. This is where you can notify shortages. How does the system know that there's shortage? If you come over to this router, you'll be able to see where it shows expected and on shift. So how do you put expected? You go to settings, you'll be able to put, let's say for instance, this staff, I'm expecting 50 staff, right? Then let's say night staff, I'm expecting 9 staff. Then I save it there. If you look at this 15 day. If I should change this to night, it shows 9. So it's actually a very detailed It's a very detailed rota. The truth is, I've worked with so many systems like Brody, Log Market. Their rota system is not like this. This is actually unique. This is different from what the other companies offer. So there's a reason why I separated the rota from the shift assignment because, like I said, the third innovation, the shift assignment, it helps staff to be able to, it helps management to be able to assign the right support level to staff such that the service needs of such that the service users requirements are met in terms of support level, required support level. So that is a good thing about it. So now, if I should come over here, let's say, okay, let's create shift for today. Today is 18th, right? So I come over here 18th. So let's say there's a day shift here, and then there's a day shift here. So these are the two staff on duty today. So I'm assigning both staff. The reason why there are only two staff here is because if you go to staff, I've created only two staff. So you can always create more staff. So back to this, if I should come to assign shift, you can see the two staff that are on shift today. They are showing here because they are on shift today. If I should come over here and remove them from shift, you won't see anybody there. Say for instance, I come over here and go to 18, then I remove these two staff. If I should come back to assign shift, you see that there's no staff available because no staff available today. If I should come back here, go to today, which is 18, and then assign staff, assign shift to them, so that now they are available there. If I should come over here, you see these two staff. So these are day staff. So if I should come over here and switch it to day staff, you see how it's activated. So now what does this mean? This is the third innovation. The system already knows the amount of staff needed a day and a night. So it's already showing you that Yusuf Mohammed requires 2 to 1 a day and Abel Hopkins 2 to 1 by night. So let me change something. Where is this information coming from? It's coming from the service user field. So if I come to service users, say 2 to 1 by day, 1 to 1 by night, 2 to 1. So let's say I change Yusuf Mohammed. Let me edit from 2 to 1. Let me make it 1 to 1 and I save it. So if I should come over here again, see that it has changed. So Yusuf Mohammed is now 1 box. Before it was 2 box. So this system is actually intelligent. It knows the amount of staff that each service user requires. The reason for this is that each in a supported living, you can have up to 4 to 1, 5 to 1. So there should be an evidence. In case CQC comes and maybe there's an incident and they're trying to investigate, you should be able to prove to the service that to the CQC or whatever whoever is doing investigation that this client or service user was provided the required legal support at the required time. And then you should be able to also bring out the staff that was on duty with that service user during that period. So now if I should come over here and then I click on this stuff, if you look at it, it's already telling me that I need 3 slots, 0 field. And if you look at this, it shows needs 2 more, showing that there are 2 staff required by this service user. And by case is a service user, if you remember. So if I should drag Chris Karen to this first one, it's like it has reduced, needs 1 more. I should drag this to this, and it tells you complete. So if I should click clear, it goes back. I can always reverse it. So let me take it here. Let me take it here. Good. If I should click clear, then you notice what is this? This is like a fairness suggestion. What does it do? This leads the these are the staff. This staff on duty. This section is staff on duty, right? So now if you look at it, it tells you that it tries to, because some services they try to rotate the staff among the service users such that one staff should not be working with the same service user all the time. So they need to know when last this staff worked with this person and when last this other staff worked with this person. So they don't get to put the staff with the same service user all the time. So they have to like give space such that the one that have worked the longest period of time should be allocated. I don't know if I'm making sense. So that is what this failure suggestion is. So it tells you when last this staff worked with Annabelle, H, and Yusuf. So if you look at this now, it shows never worked. That is because this system is new. So as time goes on, you'll be able to see the last time that this person worked with each person. Then if for instance Annabelle Hopkins last time worked was yesterday and Yusuf is last 4 days, obviously I will now need to take this person to Yusuf because it's been like 4 days when Grace worked with Yusuf. Alright, so for the sake of this demonstration, I'll drag Grace Karim to this and then drag this here. So it shows complete, right? So all I need to do is click on save draft, right? And then approve. Once I click on approve, then you'll be able to see each person that was supposed to work with the service user. Okay, let me take this off. Save draft. So that has been saved. So let me say, for instance, let me drag this to this. Okay, save. Alright, so now you can either the essence of this is even if it shows that this one is complete because this is 1 to 1, while this other one is 2 to 1. So it's requiring more staff. So from this, you can already know that more staff is needed. So you need to fill the staff. So the good thing about this, that's why from the onset while doing the graph, it shows the number of staff needed. Like now, this is 15, right? The balance is minus 14. Why? Because one has been assigned already. So if I should come here and assign another one, 12, you notice that balance reduced to 13. So this balance has to be 0 for the admin to know that the the required number of staff is complete. So if this is still showing minus this minus that, it shows that the management needs to get staff to fill the support ratio of each service user. And how do they do it? They can send it to either full-time staff or bank staff. So you can come here and notify shortages. Let's say for instance you click on this, it sends notification like now. These are the notifications for the days that are short. So now I can decide that okay, I want to send notification only to night staff, and then I want to send notification from 1st to 7th only, or let's say 1st to 5th only. So these are the days I'm sending notifications for night staff. Then I can notify shortage. So notify set to 5, notify staff notified of 5 rota shortages. Right? So now if you look at this now, you'll be able to see each. You're able to see all the staff, all the so those staff that are willing to take, they can come over here, and then this is where they come to availability, and then they choose the day they want to work. Let me say I click on this now. So you cannot submit availability because you're already on shift that day. So the days that the staff is already on shift, you cannot take availability. Let's say for instance, click on this, then save, availability save. Notice this is 15th, right? 15th of July. Then if I should come to shift, go to 15th of July, you'll be able to see something. It's showing as D. What does this D mean? This D means that this is the requested shift. That Woodland support admin requested shift on this day. And why? Because I went to request shift. If you notice what I just did. So why is this like this? This is a watermark. It shows that that's another good thing about this rota system. Sometimes staff admin actually kind of use WhatsApp to get, because I've worked in as a bank staff somewhere, and they use WhatsApp always use WhatsApp to send availability. So what the admin does is to go to my WhatsApp message, then go to the router and then start fixing it. But that is too much stress because you have to be comparing fragmented systems. But this system is so connected such that as I just requested for a day, it shows here D 12 hours. So this the day requested 12 hours. So admin can just know from the glance that this person needs day shift for 12 hours. So admin can click on it and then click on this day 12 hours, then save. It shows AP, that means approved. Then this staff will be able to know that they now have a day shift. So if I should come over here again, go to availability, go to 15, see assigned day. So it makes life so easy actually. So back to this, you see that this person has been assigned, so I can't remove it anymore unless I come over here and then, for instance, if I should come like this, this stuff. Alright, so this is it. So I can take it off, put it here. I can always drag and drop. And the good thing about this is there's also a domiciliary section whereby domiciliary is different from just normal supported living in the sense that the staff can work for 30 minutes in this client's house, go to another client, and then work for another 30 minutes, 45 minutes. So this one handles more complex domiciliary support, and this one is for supported living. So, like I said earlier, this system was built mainly for supported and residential, but then it can also accurately handle domiciliary. Why did I do it like that? Such a way that any care provider will be able to use this software comfortably. So right now, the system accounts for any kind of support level, whether supported living, residential, domiciliary. It accounts perfectly for every kind of support level. So if I should come over here now and look at staff on duty, so from here you can look at staff on duty, you'll be able to see the different staff on duty. So it shows like Greece, Woodland. So this is a very detailed system. So this one is actually very innovative because it helps the admin to know the staff on ground and the required support needed and then match it together with so much insight without guessing and without too much fragmentation. Everything is done seamlessly. So with this said, we've talked about the three major innovation in Chisom, the Ask Chisom. We've also talked about the sentiment and risk, and also talked about the support ratio. That being said, Chisom is actually here to help service providers have better insights, better visibility into what is going on. So it's not just about collecting records. What can you do with such records? In what way can those records be used to make the services run better and faster? So that is the aim of Chisom. So thank you very much for staying to the end of this video tutorial. And if there's any other information you need to know about Chisom, you can always email Chisom at info@chisom.co.uk, or you can also email us at contact@chisom.co.uk. All right. Before I leave, I also want to say something. Chisom has two modes. This is the light mode. So for those that are not comfortable working with light mode, you can also switch to dark mode. Because me personally, I prefer working with dark mode actually. So everything comes the way like this. So the dark mode is actually nice. Same with the light mode. And the good thing about Chisom also, if you come to ask Chisom, and then you ask a question, it don't just only give you results, it tells you where it got the result from. See what I checked. So from this,